This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hey, this is Jason Crowell from Norton Neuroscience Institute in Louisville, Kentucky. Thanks for listening to today's Neurology podcast. We have a special guest today. Sophie Cho is joining us. Sophie is a program director in the Division of Clinical Research at NINDS, so the National Institute of Neurological Disorders and Stroke. And we asked her to join us today to talk a little bit about Parkinson's disease research and to give us some updates. Sophie, thanks for joining us.
Thank you for having me.
So we have an interview coming up next week on the podcast where I spoke with Bas Bloem, who's a neurologist and researcher in the Netherlands, and we talked about several papers that came out in 2022 in regards to Parkinson's disease research. And so I'll go ahead and cue our listeners in to listen out for that one as well. But today we're going to talk a little bit about some updates that we think are important. So first of all, Sophie, just so we get some background here, we've got lots of listeners all around the world, and some of them may not be familiar with your organization and what their role is. So could you just as some background, give us some information about what the NINDS is and what their role is in research here in the U.S.?
So NINDS is one of the 27 institutes of the National Institutes of Health. We're the largest public funder. So the mission of the NINDS is to study the central nervous systems and brain disorders and use that knowledge to reduce the burden of the neurological disorders. And certainly Parkinson's disease is one of the main disease space that NINDS funds and supports the research.
How exactly does NINDS do that in terms of supporting Parkinson's disease research?
We have many programs, and one of the major programs to support Parkinson's disease research that NINDS supports is the UDEL Centers program that you may have heard about. So the NINDS UDEL Centers were authorized by Congress in 1997 through the Maurice K. Udell Parkinson's Disease Research Act in honor of the Congressman Mo Udell of Arizona, who had Parkinson's disease himself. The NINDS provides funding for the Udell Centers program because there was no congressional appropriations attached to the Udell Act. The Udell Centers pursue a wide range of research programs to really enhance the understanding of Parkinson's disease with a goal to improve diagnosis and treatment of Parkinson's disease, and to ultimately improve the lives of those affected by Parkinson's disease. There are also many other NINDS funding programs, and we also provide platforms for collaborative work across different organizations. For example, NINDS supports Parkinson's disease biomarker program called PDBP. And we're also one of the partner for Accelerated Medicines Partnership, or PD, called EMP-PD. And we also have many other translational research and clinical trial funding opportunities.
So can you talk for just a little bit about what area of research has made the most progress in the last couple of years? There's lots of different avenues for this, right? There's understanding Parkinson's genetics or biomarkers or treatments. What would you say have been the major advances in the last couple of years?
There have been significant advancements in the understanding the biology of the disease, really including genetics, potential role of neuroinflammation and mitochondrial dysfunction, which really led to the identification of biomarkers and potential therapeutic targets. You've probably seen the recent publication on the alpha-synuclein seed amplification assay done in PPMI cohort that was published on Lancet Neurology. So this study included more than 1,000 participants, including people with Parkinson's disease, prodromal symptoms, and non-manifesting genetic carriers like LRRK2 and GBA. And it showed that alpha-synuclein assay was really highly sensitive and specific for Parkinson's disease, and it was also highly positive in prodromal patients as well. And it also seems that assay positivity precedes abnormal DAT scan, which I think really enables us to be thinking about the biological staging of Parkinson's disease. And to me, I think this result is really important in mainly two ways. So first, the assay, I'll just call it SAA, as other people call it, SAA can be really valuable diagnostic tool, especially in the very early stage of Parkinson's disease where misdiagnosis still commonly happens. But secondly, maybe more importantly, I think it opens up the huge possibility of the disease prevention trials by identifying these biologically defined at-risk individuals even before the onset of the symptoms. So the hope is that, once we can identify these people much earlier on the disease spectrum and provide intervention, then we may be able to prevent them from going to the full-blown later stage of the disease. Currently, it is validated in the CSF samples, but hopefully when the SAA can be reliably tested in blood or nasal swab, as opposed to CSF, it could be also potentially used as a screening tool more broadly.
I understand the news about the SAA that came out, and we briefly touched on that when I spoke with Boz recently. But one of the things that we've also covered on this podcast are the skin biopsies looking at phosphorylated alpha-synuclein. Do you have much experience with those or have much to say about those?
The skin biopsy certainly has gained a lot of attention because I think, relative to CSF samples, it's easier to access. And there was a recent study results that shows that it may be able to differentiate Parkinson's disease with MSA. And I think that the utility of the skin biopsy, especially for the differential diagnosis, needs further verification and validation. But certainly it's an attractive option. Again, it's very exciting that we have this means to farm the synucleinopathy in living patients, which we were only able to do it on autopsy many years ago.
For our listeners, the paper that Sophie's referring to, differentiating Parkinson's disease from MSA, that we spoke with Chris Gibbons back on the April 10th podcast and discussed that paper if you'd like to listen into that one. Any other updates that you think are really noteworthy apart from the SAA biomarker research that came out a few weeks ago?
Well, we're excited about this SAA and possibility of disease biological staging and disease prevention. We continue to make efforts to advance the ways to manage symptoms of Parkinson's disease. So I think that there have been significant progress in terms of better delivery of the dopaminergic therapy to increase the on time without the dyskinesia and to reduce the off time. I also wanted to mention the significant progress in neuromodulation, for example, closed loop DBS. So the closed loop DBS, basically the idea is to use the physiological markers of the brain activities in real time and adjust the stimulation parameters accordingly, as opposed to current concept of infrequent and manual adjustment of stimulation parameters. So the NINDS supports this type of studies through UDL programs, as we mentioned, but also trans-NIH initiatives called NIH Brain Initiative. So yeah, more to come through that.
One of the topics that's really a hot topic right now within neurodegenerative diseases is these monoclonal antibodies. So obviously, we covered extensively on the podcast in the past year or two about these monoclonal antibodies against amyloid for treating patients with Alzheimer's disease. And then there have been in the past year some monoclonal antibodies that have not necessarily demonstrated efficacy with regards to alpha-synuclein. And so the question I wanted to ask is whether or not you think this is something that should be pursued further, or if you have any thoughts about the potential utility of monoclonal antibodies against phosphorylated alpha-synuclein in Parkinson's.
There's been a significant interest in exploring this potential of monoclonal antibodies against this phosphorylated alpha-synuclein as disease-modifying treatment. And we're also aware that there have been two recent big studies, Pasadena and Spark studies, which were negative in terms of their primary outcomes. But I think that despite these negative results, alpha-synuclein remains as an important therapeutic target for Parkinson's disease. I think that we need to better understand the role of abnormal alpha-synuclein in terms of the cascade of pathological changes and in relation to clinical symptoms. For example, we don't know the timeline of these abnormal alpha-synuclein aggregates correlate with the development of clinical symptoms. In the future studies, the enrichment of the study participants may be the key now that we have the SAA available. And also, I think that other targets in alpha-synuclein pathology, such as antisense oligonucleotides, is being explored. One thing I also want to add is that I think it's important to explore other potential therapeutic targets beyond alpha-synuclein. For example, as a combination therapy, it could be a necessary model to produce better outcomes in the future clinical trials.
Great. And as we wrap up here, you've mentioned some of the ways that the NINDS is supporting neurological research here in the U.S. So, my background is I've previously been at different academic institutions, but now I'm a private practice neurologist in Louisville, Kentucky. And so there are listeners out there who are like me, who are not necessarily affiliated with an academic medical center. What opportunities are there for us to either collaborate with NINDS or specifically one of these Udall centers that you've mentioned? If we have patients who are interested in clinical research, is there a way for us to collaborate?
Yeah, of course. I think there are several ways in which private practice neurologists can collaborate with NINDS or Udall centers if they have patients who are interested in clinical research. One option would be to use the clinicaltrials.gov database, which is a comprehensive list of privately and publicly funded clinical studies conducted really all around the world. So you and your patients may want to use this resource to search for trials based on their location, keywords and other criteria. The Udall Center website also has links to individual center websites, which provides more information on ongoing research studies and clinical trials. These websites also have contact information for the study coordinators and investigators who can provide more information and guidance. Finally, patient advocacy groups have resources for patients and people living with Parkinson's disease, including more information on ongoing research studies and clinical trials, but they also provide guidance and support for patients who are interested in participating in clinical research. Also, patients can have more active participations in the research and really voice their opinions to move the field forward through these organizations.
Sophie, what about any kind of environmental research going on? We know that there are many environmental risk factors for Parkinson's disease. These are still not fully understood. I have to say, as a practicing neurologist, seeing folks with Parkinson's every day, this is one of the most common questions I get is, how did I get this? Or grew up on a farm. Is that how I developed Parkinson's? So is the NINDS exploring this at all?
Yes, certainly that is one of the NINDS interests in recent years. So NINDS recently established an office called Office of Neural Exposome and Toxicology called OneTox. And they're working with experts at NINDS and other institutes at NIH to help study non-inheritable risk factors for Parkinson's disease, which will involve identifying and studying environmental and lifestyle factors that may contribute to the development of Parkinson's disease.
Terrific. Any other avenues of research that NINDS is exploring in regards to Parkinson's?
The one topic that I really want to mention that NINDS is interested in is the study of health disparities in Parkinson's disease. As you know, ethnic and racial health disparities are pervasive in Parkinson's research and clinical care. In research, including epidemiologic, genetic studies, and clinical trials. I saw the nice commentary published in Neurology Clinical Practice earlier this month, calling for an action on these issues. NINDS has the Office of Global Health and Health Disparities called OGHHD, and we also have a number of funding opportunities to promote research to improve these barriers and health disparities in Parkinson's disease.
Sophie, I really appreciate that overview of the work that NINDS is doing to support Parkinson's disease research. To our audience, if you want to learn more about the work NINDS is doing, and specifically if you want to learn more about these Udall Centers of Excellence, I encourage you to visit the website. You can go to ninds.nih.gov and be directed to more information. Sophie, thank you for joining us today. We really appreciate your time.
Thank you so much.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.